It can be a little test at the end, but you have some really great areas in your mouth. You have a couple of spots that are 1s and 2s, and that's awesome. That's like what we like to see. But I wanted you to look at this together with me and kind of tell me where you think you might fall in this area.
Well, I guess since I have some 4s, probably right in here.
That is correct. That is very good. You do have some active infection in your bone. And as you can see, when we're looking at your chart here, there are some areas in the upper right, the lower right, upper left, lower left. Those areas are all have some spots with bleeding. That's what the little red dots represent. So the problem is that you have infection in your bone. Okay? The consequence of not doing anything is what's going to happen is you're going to progress in disease. Okay? The great thing is I have a non-surgical solution for this. So what we are going to do is we are going to do some non-surgical periodontal therapy. Okay? And what that involves is what we're going to do is we're actually going to clean around these areas here so that we can get that infection out. So what we would do is all of the areas in there that have those bleeding areas and infection, we want to clean that out. So that's what we would do here. Right now you're really so lucky because you don't need any type of antibiotics. And sometimes when those 4s become 5s, that's when you need to have an antibiotic that sits in there for about 28 days. So you're really lucky right now, you don't have that. What we'll also do is we'll give you some fluoride varnish. The fluoride varnish, what that does is it helps with any type of sensitivity. It helps with any sensitivity. The next thing we're going to do is give you some stuff called Perio-Science gel, and my husband actually used this. It's really, really good. It's an antioxidant. This is what it looks like. It comes in a little bottle like this. And what you do is you put the gel on your tongue and then you let it sit around there, and that helps with remineralizing. It helps with regrowth and everything with the gum tissues and health. The other thing, which is the most important thing, is giving you a Sonicare toothbrush. Do you already have one of those?
I don't.
Okay, so this is going to be really great because this is going to help you succeed the best. Because I can do everything I can to clean everything out, but I got to give you something to help you clean things out. So I'm going to give you a Sonicare toothbrush, and on that day I will go over all that stuff with you,
okay,
helping you to understand it all. Any questions so far?
No.
Great. Right now, when you're kind of looking at your contributing risk factors, I know that stress is a big deal because a lot of people have a lot of stress in their lives. The other thing, and I know you and I have shared this about our infertility a lot, so pregnancy, when you're trying to get pregnant and you do have periodontal disease, if we can get this cleaned up, you're going to have a little better chance.
Okay.
So those are lots of great studies out there about that. So we'll circle those 2 things. The oral systemic link, I know that your family does have a history of heart disease, and I know yourself, you suffer from high blood pressure. So that connection between the disease and high blood pressure is a really big connection.
Okay.
We want to help that. We don't want that to get any worse. Diabetes, do you have any of that family history?
No.
Okay, very good. So what we'll do is we'll get all that cleaned up. Right now, I think you're going to have a great prognosis with that. We'll get that all cleaned up. We'll give you some good oral hygiene instructions. No surgery needed or extractions needed at this time. And what I'm going to do is I'm going to spend a good 2.5 hours just for you and I. I'm going to block that time. It's just going to be you and me, and we're going to work on cleaning all this out.
Okay.
You will not have any type of discomfort because what I'll do is I'll numb you up. Great. Can I answer any questions for you?
No, I don't think so.
All right. Well, what I'll do is I'm going to take this up front. The girls are going to give me a little cost idea, and then we'll go over the fees for that.
Okay, perfect.
Well, what we'll do today is we're actually going to clean up the top surfaces of the teeth like we normally do for every 6 months, and then we'll bring you back because there'll still be infection after we clean today. All right? Thank you.
Thank you.